biodata of her.
No, thank you so much, chairpersons. Thank you, Anuj Maheshwari sir and Dr. Sunil Gupta. And first of all, I would like to extend my heartful gratitude to Dr. Banshi Sabu sir, Vasant Kumar sir, and Sanjay Agrawal sir, and the entire team of RSS there for a fantabulous. I think one after another, they're doing a fantabulous job. So from taking from the rural now, where my learned speaker left, I will be taking you to the central of India. I think that's not working. Is this? Yes. So we all know that the patient who knows the most lives the longest. That's been already said by Dr. Ilya Jocelyn. So we all know that we need to actually educate not only the type 1s, yes, it's very, very important for the type 1s, for diabetes in pregnancy patient who is stepping into our center, for the elderly person who wants to pave their life and improve their quality of life, and also for the lady who's been recently detected with diabetes and who has difficulty in marrying. So again, diabetes education is important at each and every point for each and every people with diabetes. And can we really make these people with diabetes happy? So we all know there are different therapies, MNT, exercise, drugs, and monitoring. And the most important, the tabletop, is the diabetes self-management education and support, that is DSME. And we at Central India I would like to focus on our movement, that is Hello Diabetes, where I think with more than 25 years, like with 30 years of, we are moving into this movement. And we here at Hello Diabetes would like to talk to each and every people with diabetes. So that's our mission. And I'll be walking you through like how and where and whom, how we were doing, and how we created a chain, and how we translated all our work into research. And finally, the take-home message. So there are number of number of diabetes education papers which has showed us that the randomized, this is a specific paper which has actually showed that the diabetes self-management education programs has helped to reduce the fasting blood glucose and the HbA1c levels, and has wonderful effects on reducing the body weight, blood pressure, and even the creatinine. Again, this is another paper on therapeutic education for type 1 diabetes, which has helped to reveal that the HbA1c was significantly reduced in the patients whom therapeutic education was given, as compared to the ones who were not given. So we at Hello Diabetes try to focus on people, especially on the people who are, medical healthcare professionals, for all the doctors with multiple, with other disciplinary people, then all the paramedical staff, what sir had already said, that we focus on making the nutritionists, the technicians, and the nurses, the diabetes educators, because they are the link between the doctors and the patients. And we take enough of time on empowering knowledge for all the people with diabetes who step into our center, and empower people, not only with people with diabetes but also their caretakers. And then again, trying to give knowledge through mass educations, through communities, and also involving special groups, maybe it is type 1 or a DDM or even a couple. So how do we do it? We do it one-to-one, and we take it in a small group. So it's a learning session every day. It's not only, maybe one day in a month, but it's every day we do one-to-one. I think most of us are also doing that in a small group or a conferences like this, and a workshop, through mass education, through rallies, walkathons, and also through medias, the print media and the radio. So how do we actually do it? We do it through the lectures, the discussions quiz, we share success stories, like we have a small, sweet talk with Sunil. We share through music and songs. We have theme-based skits that has more emphasis on the patients. Then we have debates. Then we have quiz which says like सवाल आपके जवाब हमारे. Diet exhibitions and diabetic dessert competitions is of much interest to all the diabetics. And even through All India Radio, we are reaching to masses through Jeevan Ke Rang Diabetes Ke Sang. So there are different ways how we are trying to reach out to people. Especially when we talk about type 1, we are trying to empower all these type 1 through residential camps. We're trying to make them learn, share, and then finally producing all this data scientifically, and connecting them socially, and also giving them emotional support. So this is all what is needed for type 1. And how are we actually doing it? We need to understand that whatever we are doing, it should be acceptable, it should be affordable, and it should be accessible. And finally, it should be beneficial to each one of, to all the people with diabetes. So this is the Type 1 Juvenile Diabetes Parent Association, where we have been involved since more than 25 years, and we have been taking residential camps with them. These are the few glimpses which I will be taking you through. And we also learned that the fresh diabetics, they are very much involved in the education, but the older, the JDs, they are not much involved. So then finally we also took them, in involving the JD cons, and tried to share their success stories. And in fact, I would like to pay my tribute to Dr. Asgaonkar sir. In fact, he's the one who has motivated us and helped us in working in the field of JDs. And this again is 2019. Again, we had a JD Con. These are the few glimpses where we are actually connecting with our JDs. And this is the skit. I think skits help us to teach our patients in a better way, and busting the myths what prevail in the society. Then we have the role models for type 1s, and probably this is Dr. Shachindra from JDPA, and Ishan and Dr. Sonal. And these role models, believe me, they really, really motivate the type 1s. And this is really important, so that interaction between the type 1s help the other type 1s to live a better quality of life. Then these are the diabetes education, mass education programs, which we have been doing twice in a year, especially it's like the 15th August and 14th of November usually we do. And this is Meethi Baatein with Sunil, where we have most of our type 1, type 2, or role models from the society, which we help them to interact, and they motivate our other diabetics. Then we have our booklets, which this is in vernacular language, and there are most of the information which is there. And I would also like to pay my tribute to Dr. Sadikot, who was there here for launching of this booklet. Then again, through rallies, what we have said, then we are much into walkathon, rallies. And let me tell you, this All India Radio, the All India Radio programs are much, it's focusing. It is the first live phone-in programs what we started, in fact, I think 25 or 30 years back. And believe me, it's very much and people actually call us up and they tell, okay, we are really waiting for those phone-in programs. Because of COVID, this was withheld. And simple ways how you can actually educate. You can have these greetings, rather than we can have some small message can be given through your through the greetings. Then these are different education programs which we have been doing online during COVID times. Then, of course, we've done on Ramadan, So a lot of things through media and through education programs, where you can create awareness in your people with diabetes. Diet exhibition is another way where we try to impart practical knowledge by giving, actually they see the size of the chapatis and size of the katori of dal and all, that's how they understand the traffic signal. So in fact, what sir had already, so what we see is what we can remember. So in fact, diet exhibition really emphasizes and helps them to educate. Rural education, already my speaker has already told, and we are also involved into rural education. We do our regular camps at all the districts around Nagpur, and this is a long back, like I think around 10 years back, we did video conferencing where sir was here much before then COVID. COVID has taught us about telecommunication, but even like we're doing it long back, and sir was in the center, and we were actually communicating with the patients here at Mansar, which is a small village. Then we were also going since decades to Rajnandgaon, Gondia, and educating the people out over there. Also for the adolescent education, we've been creating awareness. And again, for couple diabetes, where both the couples are diabetes and they have a lot of myths what they carry. So we have a wonderful program, around 3 to 4 hours program, where the couples are really glued, and they discuss their problems over here. Then we have, we also do the social community camps. We happen to also go to the central jail, and we also found that, there was existence of metabolic syndrome. So again, we had a paper, which I have not shared. We had a paper also when we collecting the data. So always collect the data where you are doing, and try to, have some clinical data so that we can come up to some, research papers. Then the skits, we're trying to motivate through skits, because I think skits can do impact more than words. And this is a very, very famous, I think if you must have seen the Dr. Pe Bharosa Nahi Kya. This was a skit, a song which is been done by colleagues. And again, this is a skit which is depicting that how a demon of diabetes can empower can empower you. Then again, this is another very wonderful skit of like insulin and the showing the importance of insulin and Goli, and another important skit of Sajak, Sema and Bindas. Then there are also another area is what is like we are creating diabetes educators and nutritionists, and I'm very happy to share that we did the first national meeting of Association of Diabetes Educators in 2013, and with under the guidance of Dr. Chandalia sir, and Dr. Ramte sir was also there. And since 2011, we are also involved in National Diabetes Educators Program, which is done by the V. Mohan's Education Institute. And from there onwards, we are actually involved in creating diabetes educators. Now, we also focus on nurses. So we thought that we try to, educate nurses. And this again is a 7 hours workshop which we did in 2019. And there's around 1,700 nurses. And even in COVID, there were a lot of education programs and webinars which we were doing through online. And this again is JDCon, and let me tell you, tomorrow is 14 November, and for tomorrow again we have planned our 8th webinar on for the JDCon. And the COVID has actually taught us how to connect with rural areas, and this is the research paper on lipohypertrophy, which we had actually done when we had done a camp for type 1 diabetes. And let me tell you, when we did a camp on lipohypertrophy, we detected that at insulin injection site, amongst 31 type 1 children, had around 77% of them had lipohypertrophy. And then we extended our screening and did in around 140 type 1 diabetics, and then we found that the prevalence was around 69% in type 1 diabetes. And this, we have published this data in Diabetes Technology and Therapeutics. Then another important this was a poster presentation at IDF where we saw that the diabetes awareness in type 2 diabetics, and we saw that still around 50% of the people were unaware of the threshold of hypoglycemia, and 47% still felt that the diabetes is caused due to consumption of sugar, and around 64% never ever attended a diabetes education program, and even 50% of them never knew what is HbA1c. So that is the level of education amongst our people with diabetes. This again is another paper with an interventional study on nurses to assess the impact of okay, so can I just I think this is done. I'll just quickly go. I can take a minute, chairpersons? Okay, there are 2 minutes. Okay, just said. So these are again, we did the knowledge, aptitude and practice, and there we saw that there was a big gap in knowledge, attitude and practice about diabetes and its management, and we need to create more and more awareness, and I think nurses, and we need to create more and more nurses and diabetes educators and create more awareness. We also prepare a lot of videos, and we were being actually felicitated by a lot of different areas and let me tell you that in our whole journey of Hello Diabetes, so around we have done around more than 2,300 programs of Hello Diabetes, 972 Hello Diabetes public education programs, and around 1,000 CMEs and 50 diet exhibitions. And let me tell you that we have actually, this has actually benefited around more than 4 lakhs of medical professionals and around 170 lakhs of people with diabetes and their caretakers. So this, I've just grabbed this line from Dr. Banshi Sabu sir, in spite that low awareness, in spite of high prevalence, there is very less of awareness. So that is why we need to wake up before it strikes you. And my final answer and my final word, I think, to each one of you is that we need to spread education, education, and education. And I would like to extend my gratitude to my team of type 3 diabetics, our Hello Diabetes warriors, and our dedicated team of the CRC for being our support system for, for helping us to create more and more awareness. Thank you.